This is a short presentation about the external and internal airway anatomy related to our advanced airway management techniques. We're going to explain external laryngeal manipulation by manipulating the thyroid cartilage in what we call a bimanual laryngoscopy technique. And we're also going to talk about the difference between that bimanual laryngoscopy and external laryngeal manipulation and what's commonly referred to as cric pressure or cricoid pressure, the Selleck's maneuver. How those two things are very different. Here we see a portion of a diagram of airway anatomy from our paramedic text. I want to point out a couple of things. The esophagus, as you can see, running posteriorly, trachea running anterior to that. The thyroid cartilage, located externally by the Adam's apple, matching up here just above the glottic opening, and then right below that, use a different color to attempt to show that. Right below that is the cricoid cartilage, which, as you see, anteriorly is fairly small, a little bit difficult to get a hold of, and then in the back is a little bit larger. That is typically where the Selleck's maneuver or cricoid pressure technically has been performed, and what we're now teaching is to manipulate the thyroid cartilage, manipulate the Adam's apple in order to move the structures in the airway right over the glottic opening and displace those posteriorly when necessary to get your best view. So here we have a more three-dimensional looking drawing from the Visible Body app for iOS devices. We use this extensively in the classroom and did a little screenshot out of there. And so if we look at the very same structures that we had looked at before, here we have the anterior and then much larger posterior part of the cricoid cartilage, and Selleck's maneuver or cricoid pressure in theory was going to take the only cartilaginous ring in the trachea that goes all the way around and displace that posteriorly and squeeze the esophagus closed, which should in theory have kept air from going down and gastric content from coming up. There's been some research done, Dr. Richard Levitan and some others have spoken about this recently, and American Heart in the 2010 guidelines has certainly dropped Selleck's maneuver down to a much lower status than before. And so basically our point is that the cricoid pressure, Selleck's maneuver, is not an effective tool in almost any case, and not only does it not close off the esophagus, it may also collapse the trachea. So it's not that it doesn't help, it's that it actually may hurt in addition to not helping. So we wanted to show you this drawing to explain some of that. And then, as you can see, the thyroid cartilage at the Adam's apple is superior to where we should have been pressing for cricoid pressure. And I think it's been common, at least in our area, it's been common for paramedics to ask for cric pressure when what they really meant was thyroid cartilage manipulation. So external laryngeal manipulation is not new to our system here. It's just that we've been calling it cric pressure, which in fact it wasn't. Here's another screenshot out of Visible Body, an anterior view of trachea and laryngeal structures. Excellent view. I'm going to show you again the Adam's apple or thyroid cartilage, where we're suggesting that external laryngeal manipulation will help as opposed to the cricoid cartilage, which is technically cricoid pressure or Selleck's maneuver, and that's really not going to move the structures that we're looking for. There's the epiglottis up at the top, so you can see how glottic opening, cords, and laryngeal structures right below, right directly posterior to that thyroid cartilage are the ones that we're trying to manipulate. So here we see an assistant to the airway operator performing the burp maneuver, which is backward, upward, rightward pressure. So displacing the thyroid cartilage posteriorly for backward, as well at the same time moving it upward toward the head and then toward the patient's right. So backward, upward, rightward pressure is part of, or one of the manipulations that may be done externally. And we're suggesting that with bimanual laryngoscopy, the airway operator's left hand is on the laryngoscope, and the right hand, instead of holding the tube, right hand is either manipulating head into a position or performing burp or other external laryngeal manipulation. And then once that best view has been obtained, the airway operator will ask an assistant, even an untrained or trained right then on the spot assistant, to hold the laryngeal structures in the position that the airway operator's placed them. So we feel like that a relatively untrained assistant can be asked to hand me that tube or hold this right here very effectively and help us achieve, again, that single first look best view of the glottic opening.